Hypotension few hours post-coronary angioplasty. Image to follow is a normal coronary angiogram from another case of the left coronary artery in an LAO 50-degree caudal 30-degree projection. Note the LAD on the left upper corner. Initial coronary angiogram, note mid-LAD 100% obstruction. The wire was passed beyond the obstruction. The red arrow shows the area of 100% occlusion. A balloon dilation of the LAD obstruction was done. See the wire pass the obstruction and the balloon inflated. And then another coronary angiogram was done showing the obstruction being resolved. Some narrowing persisted though. You can see dye passed through the obstruction. Red circle shows where there was 100% occlusion before. A left ventriculogram was done. Note ventricular apical akinesis and dilation. The green shape where the left ventricular aneurysm or aneurysmatic area is noted. Note the dye also coming in and out. Pigtail catheter through which the dye was injected in the left ventricle, and note dye coming in and out of the apical aneurysm. Three hours and 40 minutes post cardiac catheterization, severe hypotension. The patient was brought back to the cardiac catheterization to rule out acute occlusion of the LAD. An intra-aortic balloon pump was placed to stabilize the hemodynamics. Note the balloon pump is a fluoroscopy tube was moved from top to bottom. Top marker to bottom marker of the balloon. Coronary angiogram was done on a different projection and an LAO projection. Note some narrowing of the LAD but no re-occlusion of the recently dilated and angioplasty LAD lesion. 3 hours and 50 minutes post cardiac catheterization, a transthoracic echo was done. This personal short axis view shows a fluid around the left ventricle. This is near the apical area of the left ventricle. An oblique cut also showing the apex of the LV and fluid around the apex of the LV. Then a 4-chamber view, apical view. You can see right atrial collapse in the left lower corner. Right atrial collapse. A subxiphoid window noting significant amount of fluid and right atrial and RV free wall collapse as well. 3 hours and 10 minutes post transthoracic echo, patient was brought to the operating room for a pericardial window. This trans-esophageal echo and short axis can see a large collection of fluid around the left ventricle. 4-chamber view with fluid around the left atrium and right ventricular free wall. Pericardial effusion was drained, and the post-operative trans-esophageal echo showed no residual fluid. Short axis view with no fluid accumulation residual. 5-chamber view with very minimal RV free wall fluid accumulation. Residual. You can see the LV apical aneurysm. 2-3-chamber view of the LV also, no residual fluid collection noted. In acute hypotension after a cardiac intervention, a bedside echo could provide early diagnosis, avoid delayed in care, and avoid unnecessary procedures like an intra-aortic balloon pump placement in this case. I hope you have enjoyed.